Good afternoon, everyone, and thanks for joining us on today's webinar, where we'll be describing the services that we provide through the Center for Health and Safety Culture at Montana State University. My name's Katie Dively, and I'm a research scientist at the center. And what that looks like in practice is that I'm a trainer for the center and also what we call a guide. And actually, we'll be describing in a bit what that means. I work remotely for MSU and live in Wausau, Wisconsin. Jay, my colleague, is also on the line. Jay, why don't you introduce yourself?
So my name's Jay Otto. I'm a researcher for the scientists and play the role of the principal scientist, connect the dots to all of our projects. At the center, we really promote or practice social distance. So I live on the East Coast. I live in Maryland. I'm a remote employee and have a background, formal education in engineering, but did a lot of practice at the community level around prevention and different things. So with that, I'll turn it over to our director, Nick Ward.
Hello, everybody. My name is Nick Ward. I'm lucky to be the director for the center. My background is psychology. I began my research in understanding social and cultural factors that influence our work. So I enjoy applying some of that to the work we do in our center. I'll be leading off the presentation today. My role is to give you a little introduction to what the center is and some of the people in it. And then I'll pass it over to Jay and Katie, who will finish with the presentation material. Should we go to the next slide? The first thing is just when you take a second to make sure you're comfortable with WebEx. Some of you may have used it before, some may not, but a couple of key features for you to be aware of. On the left, you should be able to see somewhere in there a little icon for the phone on the bottom of your screen. It may be hidden behind the triple dots. But this is where you can change how you are connecting to WebEx. You can either have it call you and you select a phone, or you call in and ask for the phone number, or you could use it through your computer. But if you're having trouble with your audio, one way to fix that is to try a different way of connecting. And on the right side, there's a couple of places where you can communicate to everyone online in real time. We'll be using the chat window the most. That's the one you've already used, perhaps, to enter what city you're talking from. But if you have any questions while we're talking or have anything you want to contribute, just pop that in there, and we'll be monitoring that as we go through the webinar, and we'll pick up on those points and answer your questions as we go forward. Let's move on to the next slide. So let's just talk a bit about what the center is. On the bottom right corner of our slide, you'll see our web address, and we invite you to go there and spend some time looking around and exploring the information that we have on there. The website contains information about us as a group and us as individuals, as well as some examples of the kind of work we do, the kind of services we provide, and perhaps most importantly, the sort of the science and the research that supports the work we do, in particular the framework and the process we use to do our work. But in essence, we are a university-based center. We're a center that combines a number of different disciplines, and those disciplines all relate and support each other in understanding how the culture within communities affects decisions around health and safety. And we provide a number of different types of services that relate to understanding community culture and its impact on health and safety. And we'll talk about some of those services and activities today. But in essence, we try and understand what it is about a community's culture that supports health and safety that we want to grow. And we look to where we can help strengthen and transform that culture to sustain the type of health and safety behaviors that we aspire to and that we have for the goals in our community. And again, it's a group of, as we'll see in a minute, people from different disciplines, because issues of health and safety require looking at those issues through different lenses, different types of disciplines to get the best approach and the best solutions to those issues. Next slide. And lo and behold, there I am. We have some staff on campus. As Jay mentioned, most of our staff is off campus. We're a distributed center. Many of our staff work remotely, which it turns out to be very convenient for working with communities across the country. Having staff distributed across the country makes it easy for us to get to and work with those different communities. But I'm on the left, Nick Ward. I'm working here in Bozeman. I'm also a professor at Montana State University, where the center is housed. Kelly Green, she's our business manager and also a research associate. She takes care of all the various business accounting side of things for the center. And Kelly Hall, who's with us today, is a research associate, and she's helped us with many things. For example, she's in charge of getting the WebEx up and running and all the seminars that we do up and running, and she's here on campus as well. Next slide. And here you see an example of the other remote staff that we have working with us. Jamie Arpin is working with us as a research associate. She's in Salt Lake City. Katie Dively is with us today, as you have already heard. She's out in Wazoo, Wisconsin, which I'm pretty sure I pronounced wrong. Dr. Carrie Finley is also a research scientist. She's in Cody, Wyoming. Karen Gee is also in Cody, Wyoming. And they're all part of the team working for the center. Next slide. Anne-Marie McHill, she's our center manager. She's also in Cody, Wyoming. And that's a picture of Jay Otto, who you've just heard from, who's our principal scientist and also works remotely. Next slide, please. I mentioned that we're an interdisciplinary center, and one of the ways we achieve that kind of cross-disciplinary focus is to collaborate with different faculty here on campus, as well as faculty in other universities around the nation. Here's a selection of faculty that we work with here on our campus in Bozeman. Eric Austin is in political science. Kaylin Green is a sociologist, as is Stephen Swinford. We also work with the Department of Psychology, Brandon Scott. And my home department is Mechanical Industrial Engineering, and we do work with Bill Schell, whose specialty is leadership. Next slide, please. In addition to those sort of key full-time staff, we also have a number of other contributors who are either graduate students or professionally hourly. And here you can see a variety of different people that we work with on different aspects. Preston Randolph, for example, helps us with our media material. Jubar Ahmed is one of our PhD students who is looking on the topic of emotional intelligence and safe driving. So we often have a number of contributors who change over time as we focus on different areas and need different skill sets. Next slide, please. So today what we're going to be doing is talking a bit about the substance behind the center, what we do and how we do it. And as we move forward through this agenda, we'll be talking about the logic model we use that connects culture to behavior, and in particular talk about a framework that we use to transform culture to get the desired behaviors we want in a community. And then we'll talk about the different things that we can provide in helping communities and organizations with the issues around culture and health and safety behavior. And then we'll finish off with some open time to ask questions that you may have for us and see how we can help you moving forward. Next slide, please.
So this is Jay Otto, as I mentioned before, from the East Coast. At the center, most of our research is around these four core issues. We do a lot of work on traffic safety. Historically, we've done a lot of work on the prevention of the misuse of substances, and we're still engaged in a number of projects there. We're starting to do some more work around IPV, interpersonal violence, domestic violence, and have done some work and continuing to do some work around child maltreatment and child well-being. It's interesting just to note that together these are the leading causes of years of potential life lost. They have a profound impact on the well-being of people throughout the course of their life. And they're interrelated, and I think many of you realize that. We clearly see the intersection between substance misuse and all these other behaviors. We certainly know that adverse childhood experiences, ACEs for children, can increase the likelihood of harmful effects later on in life, which can be connected to misuse of substances and therefore aspects of traffic safety. And our research is really, We like working in these different issues because part of our research is to explore and discover a shared method or a common approach that can work in these different contexts. At the federal level, these are handled by very different departments who may approach them very differently. And that may ripple down to the state level. But if you work at the community level, you know that often these overlap. Often health coalitions at the community level are working on all of these at the same time. So it is interesting to see how they may be separated at various forms of government, but how they may come back together where folks are really addressing the issues and where people are experiencing them. In our research, it is interesting for us to work in these different domains and to seek to connect the dots. So on the next slide, we have basically our center's logic model, and this is a very high level view of how we approach the work. And our fundamental research is really on exploring this idea of culture, and we intentionally label it around a positive culture, and we just self-define a positive culture as that culture which is improving health and safety. And in that research, we're seeking to understand how to define culture, how to measure culture, how to then define what would be the positive aspects of that culture that would lead to improved health and safety. How can we then grow those positive aspects of that culture? How do we facilitate changes connecting to shared values, changing beliefs that influence behaviors? And included in that is then also how to measure and evaluate that. So that's a broad overview of many aspects of our research. We then don't want to stop there. We think it's incredibly important that we also explore then how to build the capacity of a wide variety of leaders to apply this knowledge. We intentionally are very much motivated by bringing that change to community. And so that second box is extremely important. That interaction may be with national leaders, it may be with state leaders, it may be with community leaders. And we really view a wide array of leaders. Leaders may not be leaders by title, but by action, that they're seeking to improve the health and safety of the communities that they serve. And so we're really interested in that as well. And then how do we understand that to lead towards effective implementation? We all know we can take the best, evidence-based program strategy approach, but without effective implementation, we're not going to get the outcomes. So that becomes an extremely important element as well. And ultimately, our goal is to improve health and safety. And I think as a staff, we're all very much driven and motivated by that goal. It is something that is held front and center in all of the work we do. So on the next slide, we recognize this fundamental assumption in our work, and that is that if behaviors don't change, the outcomes won't change. And we often say this in the training and ground our work in this, and it's hard, but it's the reality that we accept. And so our work is a lot about understanding and exploring behavior change. And how do we get that? How do we understand and motivate that? And Katie, for a second, we've lost the slide, so we're seeing your desktop, if that can come back. Okay. So okay, we're back on. Yep. So when we think about change and seeking behavior change,
they just closed out.
We do that through the lens of a behavioral model, and that's on the next slide. So we use this is a very simplified behavioral model, but it's how we start to think about behavior. So on the far right-hand side is behavior, and here we're thinking about intentional behavior. We all experience different kinds of behaviors. Some behaviors are reflexive. If somebody hits my knee, my leg will go up, and that's a behavior, but that's reflexive. We're really talking about intentional behaviors with this model. And the vast majority of issues that we're dealing with are addressing intentional behaviors. things do get a bit complicated when we talk about addiction. And that's certainly an aspect of our work, but we're not in the treatment realm. We're much more on the prevention side. So we're thinking intentional behaviors associated with engaging in behaviors that may lead to addiction or managing addiction, which are very much intentional behaviors. Prior to engaging in intentional behavior, an individual has a certain willingness or intention, which is a component of a belief system that leads them to engage in that behavior. And the higher the willingness and intention, the more likely they are to engage in the behavior. The lower the willingness and intention, the less likely. And their attitudes and beliefs about the behavior will influence their willingness and intention. And their attitudes and beliefs about the behavior will be influenced by their general values. And their values very much may transcend the behavior. They may be much broader than the behavior, but their values will influence their adoption of attitudes and beliefs. And so this is a very helpful model for us to start to understand our research and our work with communities. On the next slide is a graphic of the current behavioral model that we work with. And I very much use the word current because our research is constantly poking at this and playing with this. And we already have ideas about how we will augment this model, but this is the model that as we currently use it. And it recognizes a wide variety of types of beliefs and how they will influence willingness and intention, and then ultimately influence potentially risky or protective behavior. So a lot of our work is trying to understand what are those beliefs, how do those beliefs interact and influence, and then how do we change those beliefs? So we do a lot of survey work. We follow up with surveys. We seek to do interventions to change beliefs, and then can we measure the changes in the beliefs? A fair amount of statistical modeling to figure out the associations between the various beliefs. But we don't have time to go into the depth here, but I do want you to see that our current behavioral model is a lot more complex than that simplified behavioral model. But it does help us understand the nature of our work is around understanding these beliefs, measuring these beliefs, and then seeking how we can start to influence these beliefs and grow a shared culture, which we define as one definition of culture as shared values and beliefs that influence behaviors. And so that, in a very quick overview, is a little bit about our work. I want to turn it over now to Katie, who's going to talk through some in terms of thinking about the work of doing this at the community level, not necessarily the research, but taking these ideas and what this looks like in the context of a project or an effort to improve health and safety.
Exactly. Yeah, thanks, Jay. So now I would like to talk about how this is applied and how we do this work. And I want to start by talking about a framework that helps us organize our efforts. And what I do want to start with is talking about or describing the difference that we see between a framework and a specific strategy or a specific program that you guys might be working on. We really see a framework as a way of organizing our efforts to improve health and safety, which in our case here with our framework, which you'll see in a minute, includes both a process for engaging in the work and then also opportunities to build skills. So when we start to take a look at the difference between a program or a strategy in the framework, we see that a program or a strategy has specific actions addressing a specific behavior. You know, that could be like a specific behavior like wearing a seatbelt or underage drinking. So you might be engaged in specific programs and strategies within your organization or within your community. It could be a curricula, it could be specific policy that you're working on. And fidelity to those strategies is really important so that you're effective. Now, a framework is different. It's a way, like I said earlier, it's a way of organizing our work. It has a generalized process that we follow. And this process that you'll see here allows us to pick the appropriate strategies and the appropriate programs. It involves skill building that helps us be more effective at the work. And also, the quality with which we implement the framework absolutely impacts our outcomes. So this is the framework that we use at the center to improve health and safety culture, or to improve health and safety, and it's the positive culture framework. I'm going to break it down for you, it kind of in bits and pieces here. We're going to start at the right-hand side of the screen with the upward pointing green arrow. And as Covey says, we want to keep the end in mind. So at the center, what we're looking to do is improve health and safety, as Jay mentioned. And the important thing to pick out here is that it's an upward pointing arrow. We are coming at this work from an appreciative approach where we're looking at growing something or improving something rather than studying and focusing all of our attention in on what's not working or what we're looking to reduce. So how do we do that? Well, we're working on increasing, protective behaviors and reducing risk behaviors across the social ecology. And to do this, we're improving cultural factors, those shared values and beliefs that impact the behaviors, like Jay just showed us in the behavior model. All right, so let's talk about how we do this. I'm going to start off here with the process, and I'm going to cover this quite quickly, but I just want to give you sort of a handle on what this process and what the framework looks like. So the process is described in the blue boxes here, sort of outlined as a circle, so you can see that it's a circle or a cycle, and that's quite intentional. It's not that we go through this the 7-step process once and we're done. We actually see that we're never done improving health and safety. It's always something that we're going to be working on, and we're going to get better at it, and we're going to get more efficient and even more effective at our efforts here. So we're going to start at step 1 with our planning and advocacy work. And just to sort of set up the expectation here, we can be in step 1 for quite some time. And this is a really important step because it sets the foundation for all of the future steps. So this is where we're building concern about the issues that we're addressing, because without building that concern and sharing that concern, people aren't going to know that it's an issue, and they're not going to want to engage to be part of that solution. Here's where we're building our team of stakeholders or our coalition or our work group. We're building the capacity of that team to do the work right along with us. Here's where we're creating goals and timelines and developing an evaluation plan. So we then move into step 2, which is where we're going to assess the culture. This is where we're going to uncover those shared values and beliefs that are driving the behaviors that Jay presented in the behavior model, so that we aren't planning the strategies or picking our strategies based on the assumptions that we have. In step 3, we're going to be narrowing and prioritizing. We understand, and I bet you all do too, that we can't do everything all at once, or we certainly can't do everything well all at once. So that we need to prioritize those cultural factors, those shared values and beliefs that are impacting the behaviors that we're looking to improve. In step 4, we're creating our portfolio of strategies, and this is sort of the understanding that there isn't one strategy that's going to effectively solve the issue. Rather, it's a mix of strategies that we're going to need in order to be effective. And this is the work of sort of determining that portfolio. In step 5 is, we're going to pilot test those strategies with a smaller subset of the population. We're going to, learn from that pilot. We're going to possibly refine those strategies or those programs wherever necessary before we go into full implementation of those programs and strategies in step 6. In step 7, we're evaluating our effectiveness, and we're determining what's needed before we enter that cycle again. And as you heard, we haven't waited until step 7, until all the way at the end, to evaluate. We've made that plan in step 1, and we've been evaluating at each step and revising as we go. So that's the 7-step process for engaging in the positive culture framework. Now I want to highlight the skills. So there are 3 critical skills that help us be more effective at implementation, and these are leadership, communication, and the integration of strategies. So the first is leadership, and prevention is an act of leadership, and I don't think that people engaging in prevention often see themselves as leaders, but you are. If you're leading people towards healthier, safer behaviors, you are leaders. And building your leadership skills and the skills of others is really critical to the success of your initiatives. For leading with the positive culture framework, we really want to be raising concern and hope. So I mentioned earlier that we know we need to raise concern about the issues that we're addressing so that people understand what the risks are that are involved, and hopefully that'll spark their interest to engage with us, to be part of the prevention effort or, the solution. We also need to raise hope. We need to give people, that path forward for change. Because without that, if we just grow concern, people can get stuck and not know what to do. So we really also need to provide that hope so we have that path forward. We also want leaders to be thinking across the different social environments that exist within their community. And we call that the social ecology. And I'll actually describe that in a minute. And finally, as leaders, we want them to be thinking about how they can cultivate transformation. We understand that we can't transform anybody but ourselves, but we can plant seeds that get people thinking and that challenge maybe their current assumptions about the behavior that they're addressing. And these seeds that they can plant really start that transformation process. And I think, Nick mentioned this earlier, ultimately what we're looking for is, to create this transformation, not only with individuals, but across systems within communities and organizations as well. Because when transformation occurs, that's really where we can sustain that positive change that we've created. So the third skill is communication, and there really aren't any prevention strategies that don't involve some level of communication, so growing our skills here is really essential. And we want to be very intentional about our communication. We specifically communicate to close gaps. What is it that people don't know, or what is the skill that needs building, rather than just being busy and telling them what we think they need to know, or assuming that they need a particular skill. We want to close a gap that's been revealed somehow in our data collection process or in our assessments. This helps us be more effective rather than just engaging in busy work. Next, we want to communicate to act as a catalyst for change. Our communications, whether that be verbal or even through a media campaign, can really change people's thinking and can create energy to address the issue and to make change. Communication is also about telling a new story in our communities or within our organizations. And, it makes me think, how are we describing our culture? Are we inadvertently creating misperceptions, that can move us in the wrong direction in our work? And really starting to think about how are we teaching health and safety as part of our culture. The third skill is the skill of integration, and I love this quote. Large-scale social change comes from better cross-sector coordination rather than the isolated interventions of individual organizations. So as I mentioned, it takes a portfolio of strategies to be effective, right? We know that there's no one strategy, regardless of the issue that we're addressing, there's no one strategy that's going to effectively solve that issue. So integration is really the skill of managing that portfolio of strategies. It's asking ourselves, are these strategies aligned well? Are they competing with one another? Are they effective, or do they need to be refined or revised, or even at sometimes they need to be eliminated if they're not working effectively? And then of course it also means, are we looking across and between systems? So looking for that alignment and that integration between systems within our organization or even within our community. So those are the three skills identified as part of the framework. And finally, the context, or where we do the work, is right here, sort of in the purple area in the middle of the 7-step process. And this is the social ecology. So the social ecology is a model that recognizes that, individuals, so all of us, any of us, we don't operate in isolation. Rather, we're influenced by the different social environments around us. So we, any of us, are influenced by our families and our peers, and that's our beliefs and our behaviors. They're impacted by these different layers. So we're influenced also by, if we're a young person, by the schools that we attend or the organizations we belong to or that we work for. We're influenced by our community's norms and laws and how those laws are enforced. So when we engage in our prevention or our promotion efforts, we've really got to be thinking about working to grow actions across the social ecology for sustainable change. Again, because if all of these layers are influencing individuals, we know that it's not enough just to focus in on those individuals. We've really got to be thinking about working across these social environments which we would consider a cultural approach, where we're growing shared positive beliefs and behaviors across a social ecology of the community or of the organization. So that was a high-level overview of the positive culture framework, and we certainly have more information on our website, and of course, informative videos and webinars on several of these of these different components, and I'll describe those in a bit. We also provide in-depth training on the framework, and that's what I want to sort of lead into here. I want to talk about a few of our services at the center. We sort of wanted to provide you with a foundation of kind of how we operate and our models for change, and now I want to talk about how we can support communities and organizations in the work that they do to improve health and safety. So some of our services include training and different opportunities to build capacity, guidance, surveys and evaluation, and then we'll cover some research projects. So to start off with training opportunities, I've just gone through the positive culture framework at a very high level, but we do offer training on the positive culture framework in a couple of different formats. We do host annually a 2.5-day training, and that's usually in the fall, and we invite individuals from anywhere to come and learn about the framework. So this event travels across the country and typically takes place in September or October. And this is a cool opportunity because it really is a very diverse group of individuals in the training. People are working on a variety of different topic areas. They have a variety of different backgrounds in the room. So that's a pretty cool event. And again, we offer that annually, and it's 2.5 days. What we do also is we offer on-site training, and we're actually doing this quite a bit. We probably are engaged in some sort of training on a monthly basis. But this is where if you are interested in having a group that you've put together be trained, so whether this be your coalition or your organization, we can come to you and deliver that training, and we can do that in a 1, a 2, or a 2.5 day format. So we can certainly do that. We can do that, and we offer the positive culture framework training in that 1, 2, and 2.5 day format. Now, if you're looking for specific skills training, we can do that in a 1 day or a 2 day format, where we would go really into depth on building leadership skills of your group, communication skills, and the integration of prevention strategies. And just a note on a portion of that communication skills training does focus on using social norms marketing as a prevention strategy. Many of our partners across the country do engage in social norms marketing as one of their prevention strategies, so we do maintain a focus on that as well. So besides our training, either our on-site training or our annual trainings that we do have a variety of different opportunities through webinars and videos. So we do offer, as you know, webinars. You're on one today on a variety of topics. Now, today is simply about the services we offer, but generally speaking, our webinars are typically content-focused or about a specific project or the latest research that we've been working on. So these webinars are always recorded, and they're posted to our website and our YouTube channel. And of course, they're always free. Because we do record all of them and put them on our website or on our YouTube channel, we do have quite a library. So please do feel free to check out our website and go to those pre-recorded webinars, because there are really quite a variety of pieces of information there. And you can see a few of those listed here on the screen. So besides training and webinars, we also have a variety of other tools that can help build your capacity as leaders and also of your partners that you're engaged with as well. So we have short videos on the positive culture framework, or those 3 individual skills that I described, certainly on the social ecology and the importance of working across a social ecology to have a sustained approach. An interesting one on how to quiet 3 voices that all of us have in our head that prevent us from learning and ultimately changing. A short video on the importance of raising both concern and hope. We know that both of those are essential in change and in our work that we're doing within an organization or within the community. So a short video there helping us understand why that's important and how to do so. So again, these are short videos that you can watch individually or even watch with groups that you are involved with. So a few additional videos that you might be interested in that are also posted on our website are what we call spotlight videos. And now these videos highlight a certain topic that our audience has requested or that we feel are really important topics to address. So you can see them listed here. We've got motivational interviewing to advocate for the positive. I mentioned that our approach is really coming from an appreciative, an approach where we're looking to grow the positive, and that can be something that can be difficult to explain to others or to even, get the courage to advocate for. So this is an awesome video by a colleague of ours, Anjali, to help you do that. There's a video on hosting effective meetings. I think we can take that for granted, but that's quite a skill. And being effective in just hosting a meeting is really important to the work that we all do. A video on medicated assisted treatment, videos on really leveraging our networks and gaining buy-in for the issues. The impacts of adverse childhood experiences. And then a really fascinating 6-part series on stigma that defines what stigma is, different types of stigma, and then how we might go about reducing it. So again, all of those are on our website. They're free to download, to watch, and to kind of watch with others as well. So that's just a little bit about our training and different tools to build your capacity. Now I'm going to turn it over to Jay, who's going to describe a bit more about our guide service that we offer, some survey work, and also our research projects.
Great. Thanks, Katie. All right, if you want to quickly just jump on your chat window and answer this question: have you ever attended a training, heard some insightful ideas, and ended up applying very little of it in your future work? So just shout out some thoughts on that question in your chat box. You can share it with everyone so everybody can see the responses. This is not something that you can send it to the host, but if you choose all participants, then everybody can see it. So if you just want to respond to that question. As I mentioned earlier, certainly one of the areas that we focus on is this aspect of bringing the research out to the field. And all of our work is sponsored by agencies wanting to move the needle on real issues. We do not do any of those sort of bizarre experiments to college students in an elevator and then publish a paper on it. Our research is very much applied. It's on real issues in community where a state or a community, sometimes the federal government, is absolutely trying to move the needle on a specific behavior or outcome. And what we've learned over the years is that training is absolutely necessary, but not necessarily sufficient. That this work of learning how to grow positive culture, of looking at the work through a cultural lens is complex. And when we really sort of tried to figure out how best to build the capacity, it's something that is largely done by doing. So Katie, if you want to go to the next slide. I'll just read this. Although employees may gain new knowledge and skills through training programs, learning alone is not sufficient for training to be considered effective. Of primary importance is the positive transfer of training, or the extent to which the learning that results from training transfers to the job and leads to relevant changes in work performance. And so this is where we've really recognized the ultimate way to get skillful at this work is by practicing it, is by doing it. And then what we recognized our role would be to guide people through that. That yes, you can come to a training, we will talk about real examples, we'll have an opportunity for you to think about your own context, but to build the skills, it's really about doing it. And so on the next slide, we developed this service over 10 years ago, and it was the recognition that it's different from just training or technical assistance. where technical assistance is often sort of solving a problem or answering questions, and certainly our role includes that. But we've never been in your context. You're the unique person in your community or your context, and we've been in other contexts that are similar. And what we really felt like our role was to act like a guide, that we've been on similar journeys, but not your journey, and we can share ideas we've learned from other journeys, but we'll learn on, walking beside you on your journey as you will learn too. So it is very much moving to practice, and it's developing skills by doing the work. And so what we do is provide extended engagement with people, typically a year at a time. It's after they've had training, so it's not a substitute for the training, because as I said, the training is necessary but not sufficient. But it's where we can then work individually one-on-one with a prevention leader or other folk, another individual who's gone through the training, doing the work to have conversation on a regular basis, to, yes, answer questions and troubleshoot, but also to help follow the process, to connect with how the project is unfolding, sometimes to connect to additional resources if something comes up that we haven't experienced before. Then the guide may bring in other members of our team to try to help address that. So on the next slide, we really talk about kind of what that looks like. So it's very much tips for implementing the framework, going through those steps. What are some ideas for engaging certain stakeholders? What if I've got a law enforcement leader who doesn't want to play or something like that? What are some ideas you've learned from other communities? How might we look at this data? What other data could I bring to bear on this? How do we prioritize this with our group or our coalition? How might we look at a logic model and on, and really helping to walk through the 7 steps, but in the context of your issue or community. We can bring to bear lots of lessons from other communities, and there's certainly an element of coaching which is going on. The guide develops, it's the same person who's guiding an individual through that year, so they develop a relationship. And there's an opportunity for not just sharing knowledge, but also that role of coaching and helping people through some of the challenging spots they may face where they get stuck. And it's maybe not just content, but other things going on as well. So on the next slide, we talk about sort of what this can look like. Practically speaking, this is a virtual service. So we're doing it remotely. So it's phone calls and also email support between phone calls. We also have additional resources that are available through an online community of practice, so getting connection with videos or other tools. And then through that guide, having a network of folks behind that guide to answer additional questions, to go to find more information. And then what we found very helpful at the end of that is to provide an executive summary, which really captures the progress that has occurred. Sometimes when you're working on something for a year and it's incremental, you can lose sight of what's been done, how things have moved forward. And so we really try to capture that and then share that back out with the individual so that they can see the progress that's been made, as also provide recommendations for what could come next. On the next slide, a couple of years ago, one of our affiliated faculty members has a master's level class, and the students do a practicum. And so we asked them, it was a class that included about evaluation. So we asked if the class could do some evaluation on our guide service. And it was wonderful. The students were able to gather some background information. They had discussions with us. They did a review of documents. They also did some more formal interviews. They collected data that we had gathered over time. They did a survey with some of the individuals that we had provided guide service over the years. They reviewed the reports that we wrote. And it was a really helpful way for us to have somebody else sort of look at what guide service was, who wasn't in the midst of it as much as we were. And on the next slide, what we really learned is that people really had a positive personal experiences with it. They very much connected personally with the guide. And we recognize that is important because the work is difficult, and being able to personally connect and sort of have that sense of support was very helpful for individuals as they move forward. We also learned on the next slide that they were growing their leadership skills, which, as Katie mentioned, is critical. I think one of the things we've recognized especially when we're working with multiple communities, perhaps in a cohort that's a part of one project, but there are multiple questions or multiple communities, that the leadership skills of the coordinator is absolutely critical. And so developing leadership skills and intentionally growing them becomes very important. They also overwhelmingly were satisfied and had a sense of value from it. So that was very important from our standpoint as well. So that's a little bit about guide service. I think it is recognizing that the complexity of this work, that yes, the training is absolutely necessary, but not necessarily sufficient. So now I want to shift a little bit and talk about some of the other resources that we provide. Over the years, we have developed a multitude of surveys, and we're continuing to evolve those surveys. The surveys help us understand the belief systems that are associated with behaviors that lead to either poor outcomes, or we also look at behaviors that lead to more positive outcomes. And so we've done surveys in the context of the misuse of substances. That could be amongst youth, parents, general community adults, healthcare providers, school staff, law enforcement, alcohol retailers. We've really looked across the social ecology at their belief systems that may influence specific behaviors that could improve health and safety. We've done some work, not a whole lot of work, exploring some belief systems around teen dating violence, as well as teens intervening with their friends if they're worried about them being in a relationship. We've done a number of surveys and different things around child maltreatment prevention. We're currently doing a project and refining a survey looking at abusive head trauma or shaken baby syndrome, and in particular about are people intentionally developing a plan about what they might do if they become frustrated with a very young child, and then also are they asking other caregivers if they have a plan. So if they have a babysitter or a spouse or a partner or a boyfriend, are they comfortable having that conversation, sort of say, hey, have you thought about what you do if you just really got frustrated because a little one was crying too much? And we know in terms of abusive head trauma, sort of thinking about that planning ahead of time can really reduce that. We've done a number of surveys in traffic safety. So driving under the influence of alcohol, driving under the influence of cannabis, driving under the influence of cannabis and alcohol, a lot of work around seatbelts, distraction, aggressive driving, as well as the lens of law enforcement and their engagement in traffic safety enforcement. And we're starting to do some exciting work at looking at the role of parents and those in a parenting role in terms of young drivers. And that can be in the context of a child is getting ready to do their practice driving so that they could go get their license. But also, what can we do with a very young child? I mean, we can have conversations in the car with a 3-year-old about the decisions that we're making about, being in a child safety seat, or what do I do at a stop sign? So we've done a lot of survey work in traffic safety. So that is something that's available. We're always interested in developing new surveys or the application of surveys. We do them online. We do them mailed. We do them in the context of organizations. We've also done some work on evaluation, where we may just have an evaluation role, where we may do some survey work to understand things at the beginning, and then some different interventions are occurring, and then we're seeking to understand what the change might be over time. So that's something else that we could potentially offer. If we want to go to the next slide, in general, we're all the time doing research projects, and our research is very applied. So we're looking for opportunities to partner with individuals, organizations, communities who want to address a topic around health and safety. We definitely tend to prioritize projects that align with our research agenda, which is really trying to understand the beliefs, grow the beliefs, see the relationship between beliefs and behaviors. And we recognize that often communities or organizations don't have the resources to fund those kinds of projects. So that may include the need to raise the money. So we certainly engage in efforts where we've got to write grants and proposals and do things like that. And that's always a part of the work as well. So that's a really quick background on some of our research and our surveys evaluation, as well as our guide service. I want to turn it back to Katie to talk about upcoming events, and we'll have a little bit of time for questions.
Yeah, sounds good. Thanks, Jay. So just an update on our next webinar, which will be on April 22nd, which is about a project that we've been engaging in over the past several years called the Together for Life Utah Project, reducing disparities between urban and rural seatbelt use. So definitely check that out. That will be on the training page of our website. And again, all of those webinars are free. And then, as I mentioned earlier, we do have that annual training on the Positive Culture Framework. It's a 2.5-day training. We are scheduling that now. That will likely be the very last week of September going into October. And we're hoping that it will be in Las Vegas. However, we are going through the contracting phase of that. So more information to come. We would have loved to have those dates, but with everything going on in the world right now, things are a bit delayed, so we will get that out as soon as we can. But those are our two main upcoming events. But you can certainly subscribe to our website and join our mailing list, and of course we will keep you up to date on any of the webinars or any of the information in terms of training that we do have. So please note our contact information here. With that, I would like to open it up to any questions or comments that you might have. And I think what I will do is start, Jay, if you don't mind, with a couple of questions that have come in through either the Q&A or the chat.
Sure.
The first one.
Go ahead.
Yeah, the first one that I see is whether or not we'll provide the slide deck after today's webinar. Now, we will not provide the actual PowerPoint slides, but we can provide a PDF of the slides if that's something that you're interested in, so we can certainly do that. Another question that comes in, it relates to the guide service and whether or not we can share some stories, some success stories, and we had hoped to do that a bit through the evaluation. But in terms of case studies, one thing that I can offer that would be, I think, as close of a case study that we might have is a webinar where we engaged in an interview with a guide client. And it's a recorded webinar that's on our website. It's called What is Guide Service? It's a pre-recorded webinar, and this particular guide client worked at a community level trying to reduce drug and alcohol use, and it was just an in-depth interview where she shared what the process was like of engaging in guide service, what they felt were the outcomes and the benefits of it. So again, that would be on our website under our pre-recorded webinars, and it's called What is Guide Service?
And I think I'd also add, we often integrate forms of guide service in the projects that we do. So for example, that upcoming webinar about the Utah Seatbelt Project, that was a project where local public health coordinators located and serving a county were the implementers using tools and resources developed using the Positive Culture Framework. And we provided guidance, ongoing, regular monthly guidance, like guide service for them over the period of time. And that was an exciting project where the communities were able to significantly impact seatbelt use in the rural communities and significantly reduce the disparities that were occurring between seatbelt use in rural communities and urban communities. So that's another sort of broad example. And so I think that's an interesting question in terms of exploring that, and something we want to continue to look at and explore more. Another question coming in: has this framework been applied to Vision Zero Towards Zero Deaths initiative? So we absolutely are thinking about it in that context. Our traffic safety work is very much through the lens of TZD. We also are exploring understanding assumptions that people may have grounded in Vision Zero and towards zero deaths, and how those assumptions may be influencing their adoption of attitudes and beliefs about engaging in the work of Vision Zero or TZD. We're engaged with a DOT right now, applying this framework to examine their own safety culture, with the recognition that they're a zero death state, and that really the work of going towards zero deaths at the state level really begins internally. So how do they as an organization really commit to zero fatalities, zero serious injuries within their workplace to create the context for them being more effective going out to their state? So we're in the work of doing that. We just completed an organizational-wide survey with them and are going to now be moving towards step 3 and 4 to really prioritize the opportunities and develop a portfolio of strategies to focus on growing their own safety culture. So it's very much an issue that we're looking at in terms of TZD. We're also doing a lot of work exploring driving under the influence of cannabis and its impact. We see a lot of polydrug use, so that's coming up as a major issue with TZD efforts. Another question, do you have resources on taking risk as prevention educators? I'm thinking about closing gaps versus being busy, and that sometimes the busyness comes from being worried about risk. Absolutely. I mean, right, this is where the aspects, I think, from the guide service and other things come into bear in terms of both coaching and training. So sometimes we may see aspects of what we need to do, but it's not happening for a variety of reasons. That may be coming because we don't perceive support from the coalition. We don't perceive support from leadership. We don't perceive support from our community. So how do we sort of push through that and move forward? So that absolutely comes up. That short video, it's about a 20-minute video about advocating for the positive, is a great example of a quick tool we wanted to create for that. Anjali Nandi talks really about applying the lens of MI to address very difficult topics, and she's got some great wisdom in that video, but that absolutely comes up a lot. Are the evaluations specifically on traffic safety available on your website? So whenever we finish a project, project reports are definitely published and available on our website. So we have a lot of previous work project reports on our website. We also seek to publish articles about those as well. We're in the midst of a very exciting project with a pooled fund on traffic safety culture, which is sponsored by the Montana Department of Transportation. And one of the projects they're funding is understanding where we are with the state of evaluation around cultural approaches to address traffic safety. And the research study was done by an affiliated faculty, Professor Eric Austin. And what we're learning is it's a very complex issue. There aren't a lot of good evaluations from a cultural lens, and it's very difficult to do some of that evaluation. So our task over the next couple of months is to distill some of what Eric pulled out of the research into some guidance. And then there will be some upcoming webinars, articles, and resources developed over the next probably 4 to 5 months specifically on that topic. So that's a really good question and a very challenging question. Another one, who should I contact about an opportunity to collaborate on a substance abuse project? So a number of ways. The easiest way is from our website on the contact. You can go through that email, and that will come through our system as a center, and then we can sort of figure out who on our staff is the best one to address that. So that's probably the easiest way to outreach, is just to go right through that email to the contact us on our website, and then we can go from there. Katie, Nick, other things you want to add?
No, but I appreciate everybody taking the time to be with us today.
Absolutely. We know that sort of virtual interactions is the state of a lot of interactions right now, and we certainly hope everybody navigates the current pandemic safely and and hopefully we can move through these challenging times. But we certainly appreciate your attention, and we certainly appreciate all the work that you do to improve the health and safety of the variety of communities that you serve.
Yeah, stay safe, everyone.
Bye. Thanks.